This presentation is about the imaging changes of brain metastases after they're treated with laser interstitial thermal therapy, also known as LIT. And this study has been just recently published, so you can refer to the full publication if you want. So the LIT procedure for brain metastasis consists in the placement of a laser fiber in the tissue where laser can achieve heat-induced ablation, and the temperature of the tissue is monitored through MR thermometry. The clinical indication is usually not as a first line. First line is still surgery or SRS, so radiosurgery, for instance, gamma knife, but it's usually used as for recurrent lesions. After they recur, they grow back. Also because it's effective both of recurrent lesions and radiation necrosis. The imaging of LIT-treated lesions is still a bit sparse in terms of how it's been characterized. There are historical articles showing and describing T1 and T2 weighted changes after the treatment. And at this point, we are confident in saying that we expect that the lesions grow, especially in terms of contrast enhancing volume right after the treatment. There's been multiple reports. However, more comprehensive studies showing the volumetric changes over a longer time span, and most of all, diffusion changes are still lacking. So what we did is we went back and studied about 300 MRI scans from 47 metastases, and we looked at how imaging changes were happening. Also, while stratifying between progressive lesions, lesions that responded to the treatment, or lesions that showed long-term disease control after the treatment. We segmented separately, the enhancing part, the non-enhancing part, and the whole lesion to pull volumes and diffusion metrics. And this is a representative case of what the typical radiographic response pattern that we found should be expected to be. Right after the treatment, there is a lesion enlargement, mostly of the enhancing part, and then there is a shrinkage, what we call a two-phase shrinkage over time. As you see, the enhancing portion of the tissue shrinks over time, this after 3 years of follow-up. And diffusion shows immediately a diffusion restriction. You see how from green it becomes blue in the color map, and then a gradual diffusion increase over time, long term. Same for this other case that we show, where there is increase immediate after the treatment and then shrinkage progressively. And the same for diffusion, as said before, there's diffusion restriction followed by progressive diffusion increase. Looking at quantitative data, we confirm in all cases, or most cases at least, there is a volumetric increase in the whole lesion, which is mostly driven by a volumetric increase in the enhancing component. We did not see a significant difference between responders and lesions that would progress after the treatment, but it's possible that this study is underpowered to catch this difference. What's interesting in the long term is that we can model the volumetric changes over time, and we see that responders follow a two-phase shrinkage over time, whereas the progressors shrink at first. We're starting from the post-treatment time point. So after the first initial volumetric increase due to the treatment, there is a two-phase shrinkage, or in the case of progressors, there's a first shrinkage and then they bounce back and regrow. And if we overlap the model fits, we see that there is a great overlap in findings between responders and progressors in the first, let's say, 3 months, and only after they do diverge. In terms of diffusion, as we said, there is a diffusion restriction right after the treatment that becomes even more after the first follow-up. Again, we didn't really see any difference between treatment response groups. And for responders, the trajectory is that after this first dip in diffusion metrics, the diffusion will go up and higher than baseline eventually. So we are proposing a typical response that is expected in LIT-treated tissue of brain metastasis, with an early enlargement and diffusion restriction, followed by progressive two-phase shrinkage and diffusion elevation. It's important to understand that in the early time points, these findings are not exclusively seen in responders, but also progressive lesions in the first time points can show overlapping patterns, and that also exist rare atypical responders that are that show diffusion elevation instead. And you may want to refer to the full article for more details. This is my contact information, and thanks to my collaborators for helping out on this project.